First step to heal. Tendinitis, bursitis, and shoulder impingement end the pain.
Ever wondered why that shoulder pain doesn't seem to go away? Well, you're not alone. Many people across the globe grapple with persistent shoulder discomfort, often attributable to conditions known as shoulder tendinitis and bursitis. Shoulder tendinitis is a condition characterized by inflammation of the tendons in your shoulder joint, often resulting from overuse or strain. The symptoms might include a dull ache, tenderness, and occasionally loss of motion. On the other hand, shoulder bursitis occurs when the bursa, a small, fluid-filled sac that reduces friction in your shoulder joint, becomes inflamed. This can lead to pain and stiffness, especially when you move your shoulder. Both these conditions can significantly impact your day-to-day activities, making it essential to understand them better. This knowledge will not only help you identify these conditions, but also seek timely medical intervention. Stay tuned to learn more from medical experts about shoulder tendinitis and bursitis. Now hear from Dr. Smith, a renowned orthopedic surgeon, about the intricacies of shoulder tendinitis. Dr. Smith's expertise begins with the anatomy of the shoulder, a complex network of bones, joints, and muscles. One of the most vital components of this network is the tendon, a cord-like structure that connects muscle to bone. When these tendons become irritated or suffer microscopic tears, the body responds with inflammation, the process that leads to tendinitis. Dr. Smith goes on to explain that shoulder tendinitis is not a condition that discriminates. He sees patients from all walks of life, from professional athletes and construction workers to office employees and homemakers. However, the common thread among his patients is often repetitive shoulder movements or overuse, leading to the wear and tear of the tendons. He also notes that age plays a significant role. As people age, tendons naturally lose their elasticity and become more susceptible to injury. This, combined with a lifetime of use, can often lead to shoulder tendinitis in older adults. But Dr. Smith emphasizes that lifestyle choices can significantly impact the likelihood of developing this condition. Regular exercise, balanced diet, and proper rest can help maintain the health of your tendons. Conversely, a sedentary lifestyle, poor nutrition, and lack of adequate rest can increase the risk of inflammation and tendinitis. As Dr. Smith highlighted, anyone can suffer from shoulder tendinitis, but certain activities and lifestyle choices can increase the risk. Scene script. Next, let's hear from Dr. Johnson, a physical therapist who will explain shoulder bursitis and its management. Delving deeper into the subject, Dr. Johnson expounds, shoulder bursitis, often referred to as bursa inflammation, is a condition that arises when the bursa, a small fluid-filled sac that cushions the bones in your shoulder, becomes inflamed. This inflammation can be triggered by various factors, including overuse, injury, or an underlying health condition. Moving on to the common causes, she elucidates, repeated overhead activities, heavy lifting, or even poor posture can contribute to shoulder bursitis. It's also worth noting that certain health conditions, such as rheumatoid arthritis, can increase the likelihood of developing this condition. Dr. Johnson then delves into the effective treatment methods. The primary goal of treatment is to reduce inflammation and alleviate pain. This often involves rest, ice application, and physical therapy. In some cases, medications or injections may be required. She further emphasizes the importance of preventative measures and exercises, stating maintaining good posture and incorporating shoulder strengthening exercises into your routine can help prevent shoulder bursitis. Moreover, it's crucial to listen to your body and take breaks when necessary to avoid overuse. As Dr. Johnson emphasized, a combination of rest, physical therapy, and lifestyle changes can significantly improve the symptoms of shoulder bursitis. We've learned a lot today about shoulder tendinitis and bursitis. It's been an enlightening journey delving into these common yet often misunderstood conditions. We've discovered that both tendinitis and bursitis are typically caused by overuse or injury, leading to inflammation and discomfort in the shoulder area. The symptoms, though similar, have subtle differences. While tendinitis often results in a sharp pain during activities, bursitis tends to cause a dull ache even at rest. But remember, these conditions are not exclusive and can coexist, complicating the diagnosis. The good news is there are numerous treatment options available, ranging from rest and physiotherapy to medication and, in severe cases, surgery. But prevention is always better than cure. Regular exercise, good posture, and a balanced diet can go a long way in maintaining your shoulder health. Remember, taking care of your shoulder health is crucial. Don't ignore persistent pain and seek medical advice when needed. Thanks for watching, and stay healthy.